All right, everyone, let's get started. Thanks for jumping on today. I don't know if that was exactly 30 seconds. I did not set a timer. That was a guess, but here we are. Thanks for jumping on. Today, we're going to talk about how to address healthcare workforce challenges in underserved areas. This is a topic that's really, I think, pertinent right now, and also one that we've gathered some data on recently that we wanted to share with you today. And then we'll talk about some best practices in this area. So we're excited for this topic and excited you've all taken time out of your busy schedule to join us. In terms of housekeeping items and how we'll structure this, we'll go through the material and take your questions both as we go and then at the end. If you have questions, just go to the little chat or Q&A areas, type those in. We'll monitor both, and you can ask questions, make comments there. At the conclusion of the webinar, you will receive a recording of the webinar today. And then also someone will reach out and follow up with you to see if you have additional questions. The other thing that I wanted to mention as well is timing today. We're not believers in 90-minute webinars that take your whole afternoon, your whole morning, depending on where you are. We'll try to keep this relatively short, around a half hour or so, and get you back to your day. So thanks again for jumping on. Our speaker today is the incredible Sarah Sweat, the Chief Client Officer at Incredible Health, who many of you know, I'm sure. Sarah, thank you for taking time out of your busy schedule to join us today. We're excited you're here. Why don't you take a second just to introduce yourself to people who don't know you, tell everybody what you do at Incredible Health, and anything else you want to mention.
Yeah, absolutely. Thanks for having me. I always enjoy these discussions and getting to speak with our health system partners and health systems across the nation. I am, as you said, the Chief Client Officer for Incredible Health. I've been here about 2 years, but I've really spent my entire career in healthcare tech. Got my start as a recruiter. And so I have been the person that is carrying 100, 150 recs and dealing with the chaos that ensues when that happens. So I'm really privileged to get to work with nursing leaders and with talent acquisition leaders across the country, helping to bridge the gap and help nurses and health systems connect and share, sort of create an optimal environment in which they can operate together.
Awesome. Well, we're excited you took time out of your schedule to jump on the webinar today. We're going to just talk briefly about the nurse labor market today, tell you a little bit about Incredible Health, who we are and what we do. We'll share a little bit relative to some nurse hiring and retention data, and then we'll talk about how to address challenges in underserved areas and take your questions. All right, let's talk about the nurse labor market today first and foremost. And Sarah, jump in here as well. Obviously, healthcare has been the #1 employment sector for quite a while. 1 in 8 Americans work in healthcare, and it's obviously the backbone, the foundation in many ways of the economy. But the actual shortage is getting worse. So 1 million nurses short by 2030 in the U.S. And then the stat that we change it periodically on the far right-hand side of the slide here, 95 days right now is the average time to hire a permanent specialized nurse. That number moves around a little bit. Sometimes it's around 85 days. Sometimes it's sitting at 93, 91, 95 is where it sits right now. That number never ceases to amaze me, even though I've seen this slide a lot. Sarah, you were in the weeds on this every single day. Does that number moving up and down surprise you at all? Any insights you have for people who might be surprised with that number? And I'm guessing for the audience on the call today, very few are going to be surprised by that.
Yeah, it's the painful reality that nursing leaders and talent acquisition leaders are faced with every day. Is what's troubling to me is that number does fluctuate, but it has continued to rise overall as a trend. Our target for health systems that are hiring on the Incredible Health platform is to be hiring in sub 20 days. When you do that, you not only capitalize on top nursing talent, but you can do it in a way that beats out the competition, that is faster and therefore optimizes your health system to capture the highest volume of talent as well.
Yeah, that's a great point. Just the ability to speed that process up has ripple effects throughout not just the nursing staff and patient care, but your entire health system. All right, what does Incredible Health do? Sarah mentioned this, but hospitals use our matching technology to hire high quality permanent nurses in less than 50 days. So, 1 in 4 US nurses are using Incredible Health to manage their careers. They have profiles on Incredible Health that they're actively engaged in. And then 700 to 750 US hospitals, including about 75% of the top ranked hospitals, are using Incredible Health to hire permanent nurses. So, we really try to match nurses with hospitals in a very, very technologically savvy and fast way, and it's what we're really good at and what's really important to us. Okay, let's talk about helping in underserved communities here. Now, the problems that we're going to talk about today, particularly for underserved communities, are not necessarily exclusive, I would say, to underserved communities, Sarah, but they might be more exaggerated in those communities in terms of hiring rapidly and making sure you have the right number of nurses and on a shift or on a floor. But these are not exclusive to underserved communities, but they may be exaggerated there. Sarah, what any thoughts on that as we jump into this topic?
Yeah, I think that's a really good way to say it, McKay. I think these health systems in these communities that are low to moderate income communities are critical for a care delivery for the people that live in those communities. And so I think not only are the problems exaggerated, but the stakes are even higher for the individuals that seek care at those facilities.
Yeah, that's a great point. Okay, and then I'll give you some background as well. We recently did a little bit of data analysis around the number of nurses, the number of hospitals that are our partners that are serving low to moderate income communities, LMI communities. So 25% of Incredible Health's hospital partners operate in low to moderate income LMI communities. That's data across our hospital partner portfolio. And the thing that's, I think, kind of fascinating about that is the impact that these hospitals have on those communities, both as an employer, but both serving the populations there. It's a really high impact member of that community, or those hospitals in those underserved areas. Sarah, the impact they have is dramatic.
It really is. I think that makes the pressure on those hospitals and health systems even higher to attract and retain high quality nursing staff. Because healthcare is never a nice to have, right? It's a necessity. But in these communities, it's a lifeline
Yeah.
for these areas that are often facing really persistent social and economic challenges.
Yeah, it's a great point. This was, I thought, a really interesting quote from Omar Reed, the Chief People Officer and EVP at Harris Health System. He says, "Our partnership with Incredible Health has helped us hire even more permanent, specialized, and experienced nurses rapidly throughout our facilities." So they rely on Incredible Health to hire nurses in sometimes these facilities that are harder to hire in. Have you noticed, Sarah, and does your data show that sometimes hospitals in those underserved areas, it's a little more challenging even than any other hospital to hire nurses? Is that a problem that these LMI hospitals or hospitals in LMI areas are facing? Is even more challenging hiring situations?
Absolutely. I think where we see that happen in our data is the interview request acceptance rate. So, this is the rate at which nurses are saying, yes, I want to have a conversation with a recruiter from the health system. Typically, in these health systems, that's a struggle. And it could be as a result of a brand perception, it could be as a result of the physical location of the hospital. But for these health systems, uh, the sort of that are already operating on these sort of razor thin margins, we have to overcome that perception gap, because for many of them, permanent nursing staff is truly the only sustainable staffing strategy that they have. The communities that they're in can't afford for these hospitals to close. They really rely on the care and the source of employment for that community. Understanding the unique challenges of this type of health system and enhancing our product to intervene on that health system's behalf and explain the unique benefits of working in a low to moderate income area can go a long way in helping nurses understand the advantages, and there are many of them in working in hospitals in this type of environment.
Great point. And then from the nurse standpoint, I thought this was really interesting. And you talked about the impact that these facilities have on the communities they serve. 27% of nurses are relocating to work permanently in low to moderate income communities. So nurses are not only, we sometimes fight the perception that nurses are not willing to relocate. Our data shows again and again more broadly that nurses are very willing to relocate in all over the country. But then this is really interesting is that 27% of nurses relocate to work permanently in low to moderate income communities, which helps the community itself, but also gets, I think, the patient experience and improves the actual facility itself. Does this surprise you? Because when we pulled this data, we kind of did a double take around the impact that this hiring actually has on the communities themselves.
Yeah, I love this stat. And I'm excited to see this stat to trend this over the next couple of years because I think what this tells me is that the issues in hiring in these LMI communities is not really one of disinterest, but it's about more limited awareness of the opportunities. And so, what we hear from nurses that are on our platform and then have access to 700 hospitals plus nationwide with this kind of active marketplace and nurse community is that it's allowing them to become aware of these opportunities differently, not just aware of the existence of the opportunity, but of the unique benefits to working in these health systems. And so, when nurses have a heart to work in this type of environment, we're helping them bridge the gap of figuring out how they could make that work for their life.
Yeah, that's great. And then this is, I think, a really great quote from a nurse, Jennifer. She said, "I wanted to be a nurse because I saw an opportunity to help people. Incredible Health was like my guardian angel and helping me to find a position in a community I cared deeply about." Now she has amazing retention bonus, great pay, and a new facility just 30 minutes from my home. So I think this is, I think, just one of thousands and thousands of examples that we could share from nurses, but particularly Jennifer, who was hired at a hospital in what would be considered an LMI community. Any thoughts on Jennifer's quote, Sarah? I know you hear this stuff a lot.
I do, and I always love it. Nursing is a caregiving profession. And so, what I love most about this, what Jennifer has said, is that she is a caregiver who felt cared for in her process with us. We exist to help healthcare workers live better lives and find and do their best work. And so, this speaks exactly to that core mission of Incredible Health. I love seeing that. I also love that she highlighted some of those unique benefits that she had access
Yeah,
to
yeah.
by following her passion to work in a community where she felt like she could truly make a difference.
That's a great point. People want to feel like they're serving and working in a community that's making where they're making a difference. And this is just one example here. So I think, and we'll talk about this more in the upcoming slides, but if you are at a hospital that is in an underserved or LMI community, don't like, there are unique challenges that you face, but there are also some actual like advantages and things that you can take advantage of, perhaps maybe is a better way to say it, for people that want to work in a community that they care about a lot. And I think that's really important to note. Okay, let's dive in here. How does Incredible Health specifically help in underserved communities? Let's talk through each of these a little bit, Sarah. So there's a large talent pool on the platform that's pre-screened and custom matched both within and outside the communities who match the health system's roles. So you're instantly not going to be meeting with and interviewing people that are not willing to work at your facility. Sometimes we hear, right, in these communities that people are like, the nurse didn't want to come work here. They didn't want to come work here. that whole process, that whole problem is eliminated based on the way we match nurses and employers. Would you just speak to that a little bit more and how we help kind of avoid the mismatching?
Yeah, I think it's especially critical in this population, this cohort of hospitals, to invest time early in our onboarding process. We actually spend a significant portion of time speaking with the recruiters who and the nursing leaders who know the reasons that nurses stay and come to that health system, what's unique and differentiated about the opportunity there, and then we're building out mechanisms through through the externally facing sort of advertisements that we have to attract nurses to that health system, but also within the process. We have a whole team of talent advocates who walk with nurses through the entire process, and we arm them with those unique things, so we're helping to inform them about the those unique attributes of the health system, so they're pre-screened, and we're leveraging all the information that they have provided to us to match them and identify these nurses that have that heart that Jennifer did for making a difference in a community with those health systems that can deliver that for them.
That's great. And then the speed to hire rate is awesome. We've talked about that a little bit before. The cost savings really, really critical, particularly for hospitals in these communities, which I think is important to note. And then the retention rate is one that I want to highlight a little bit because this I don't think we talk about enough. Retention of permanent nurses is difficult in any hospital, but there is some data that shows that it could be potentially more difficult at hospitals in underserved communities. But nurses that are hired through the Incredible Health platform have a 15% higher retention rate than your baseline retention rate for nurses. This is a huge deal, particularly in hospitals, as you said, Sarah, in this cohort. Anything you want to mention on retention? Because I think this is something we get asked about a lot. They're like, man, is it too easy to hire? Is it so easy to hire that people leave quickly? The data actually says the exact opposite, that people love that fast, seamless hiring experience and therefore stay a little bit longer.
I think it's what you really need in terms of helping a nurse be hired quickly and then have the match accuracy or quality to help them retain. It's a mix of that high tech and high touch, which is something I'm really proud of how well we do here. That high tech aspect of moving them through the process quickly, helping health systems optimize their own internal processes to ensure we're giving a nurse a really high quality experience that's a competitive differentiator. And then also that high touch. So our staff that works with the nurse every step of the process helps them, really ensures that we understand what they're looking for, increases the likelihood that that nurse will stay at the health system longer.
How much of it do you think is if a hospital is able to hire that quickly and their processes are that good at the front end of the process, that may indicate something um, larger, maybe about the overall way the hospital runs and the seamless nature of it? Do you think it's maybe a leading indicator of just the smoothness with which everything works in the hospital, or am I
Well,
overthinking that?
yeah, I'll say our nurses believe that,
Yeah,
right? As any good recruiter will tell you, you are being interviewed throughout the hiring process just as much as you are interviewing that candidate. And so that nurse is getting a sense of what the culture is like, where what is prioritized in that hiring experience that they have. They're getting a preview. They're treating it that way. And so anything we can do to make that as high quality experience as possible really increases offer acceptance and ensures that that nurse feels cared for, that they have the ability to make the decision that's best for them, and they have incentives that align with their unique career goals and what they're trying to accomplish out of seeking a new position.
love that. That's awesome. And I love the way you said that. Whether or not it's true, the nurses feel that way. And that's kind of all that matters. That's great. Okay. Let's talk a little bit about retention. What can you do to retain nurses? So this has taken really from like a huge amount of data that we gathered from nurses and leading hospitals that do a great job at retention. Let's go through each of these and talk about them. So flexibility and scheduling is the number one thing that comes up. What are we talking about when we talk about flexibility, Sarah? Are we talking about like different shift flexibility? Are we talking about make your own schedule, or does it look different depending upon the hospital and the situation that you might be in?
Yes. My answer is yes. It's all the things. We actually recently released a survey to the nurses on our platform, asking them about the things that were important for them in their evaluation of a new role. And 98% of respondents said that self scheduling was at the top of their list. And so this means the ability to influence when you're working and ensure that that schedule can work for your life. There's natural tension here. Health systems have to have sufficient nurses on the floor to deliver high quality care. And that means nobody's going to get exactly the schedule they want 100% of the time. But if nurses feel a sense of autonomy, a sense of control over that, an ability to make changes as their life, sort of demands, then that matters to them in their evaluation of a health system. It's one of those things you talked about earlier in the hiring process that we can talk about that will portend well for the experience that that nurse
Mm,
has once they're on the floor.
that's great. Plus extra credit to you for using the word portend, which was great. Um, benefits, mental health care, relocation benefits are something we're seeing. Are those becoming more common as hospitals try to attract nursing talent? And how does that look? Like, is it a one-time payment? How does that work usually?
Yeah, I'm seeing a shift here from what we've seen in previous years. Really, what I'm hearing from nurses is a desire for, these robust benefits, diversified benefits. One of those is a relocation benefit option. Typically, what we saw a year or 2 years ago was a lot of sign on bonuses that were specifically targeted to get nurses in the door. The dynamic has shifted a little bit. And so I see more of those sign on bonuses moving to a relocation benefit or to a retention benefit. So these are bonuses that are paid out over a longer period of time. If it's relocation, it's more upfront and then smaller portions paid out over time so that you're not just incentivizing somebody to get in the door, but you're incentivizing them to consider your hospital from across the nation. And you are making it easier for them to make that transition, but you're also tying it to the thing that these health systems need more than anything, which is retention of those nurses.
Love that. That's awesome. Strong patient to staff ratios I thought was really interesting. And then career mobility planning and cross training. And this was also showed up in our nurse survey around generational differences, how younger nurses are wanting that cross training more rapidly and wanting career advancement opportunities, or at least a path to those opportunities more rapidly. Anything you want to speak to on any of the rest of these on the slide here, Sarah?
Yeah, I would definitely say, every nursing leader that I talk to says, I know, we want to offer cross training opportunities. We want true career mobility planning, want to sit down with nurses and figure out how they want to grow their career. I want to do all of that. I don't have enough preceptors. I don't have enough people who are experienced nurses who are able to go with them on that journey and give them that cross training. And that makes sense, right? That's happening not only because we know we want to offer this benefit, but because we have more novice nurses in health systems than we have in quite a while. And a lot of these novice nurses that came up during the pandemic didn't get the opportunity to do clinical practicums in the way that previous generations of nurses might have been able to. And so that creates this gap in soft skills, nuances of how to do the job that our more experienced nurses just excel at because they have had the opportunity to do that more. We don't incentivize preceptorship uh, well enough to incentivize people to say yes, right? It's still usually more work than it is benefit for an experienced nurse to take on a less experienced nurse. in that capacity. And so what I have seen, especially health systems in LMI communities do really well, is to make that preceptorship more attractive by leveraging all the things that are above it on this slide. Certainly, a shift differential increase is helpful in incentivizing the behavior, but we found it's not sufficient typically to just throw money at this problem. But offering them stronger patient to staff ratios, offering them sort of the first opportunity to fill out their vacation request or first pick for holidays, helping them, giving them flexibility in terms of the shift options that they work when they're in this capacity really helps in a low cost, less disruptive way, incentivize nurses, help them see the unique benefit of working in this capacity and help us bridge the gap between less experienced and more experienced nurses.
Love that. That's a great answer. Okay, we talked about this a moment ago. Incredible Health is used by 750 plus health systems and hospitals that are using Incredible Health to hire permanent nurses in under 20 days. Just some awesome logos on here and a lot more we couldn't fit on the slide. We always get asked this, which is why nurses join Incredible Health. Like, okay, I get why hospitals do, they get to hire faster. Why do nurses join? And I think this slide actually lays it out pretty well. Like they want us to help them with their career. They want to connect with hospitals. They also want the free content that we provide. And they know that it's a great place and probably the best place to find a nursing job that matches with their skills and their goals. Anything you want to add on why nurses join, Sarah?
I think they know that we value nurses greatly. For us, nurses are superheroes. And this is just a small part of what we feel like we can do as an organization to say thank you for the people that have been on the front lines of health crises forever and who deserve to have an experience and access to the kind of education and support that they need to grow their careers and to feel appreciated for the work that they already do.
That. And then, of course, we showed you a quote earlier, but just 5 stars from nurses all over the place. And then just to reiterate again what we do. So employers apply to candidates instead of the other way around. So as we said, particularly with hospitals in underserved or low to moderate income areas, you have a leg up because the nurse is choosing you, right? Like you're engaging with these nurses, and they already know precisely what they're getting into and they want to talk to you. So that's, I think, really important. And you can apply to them at that point. And we, with a lot of technology and screening and algorithms and data, match the hospital and the nurses together. Anything you want to mention about the process here, Sarah?
No, I think as I mentioned before, I think this is a place where we have to work quickly and in a way that's high tech. So that matching algorithm and data analytics provide our health systems insights that they just wouldn't have any other way. Why are nurses saying no to an interview request? Why are they dropping off in the funnel at various places? And then what are the strategies that we can provide them to help overcome those barriers? It's just, it's great to see eyes light up with our health systems when we can share some of these insights that they just don't have the ability to get for themselves.
It's a really interesting point because the last thing you want is to have all this fancy matching up front and then a cumbersome process after that, right? You've got to have the internal processes defined, and we help with that. But you've got to make sure your processes internally move rapidly after this very efficient start to the process. It's a great point. We've talked about this, cost less, 50% less per hire on average. Talked about retention a little bit. And then the process, just to reiterate this, like where we start and then where really the hospital takes over. You can see the process here. And this does and you talk about this a lot, Sarah, is to free up the recruiter for the high skill relationship building work the recruiter should be doing. So our goal is to remove a lot of that manual busy work that they do at the front of the process and give them time to do what they're really good at. Okay, let's talk a little bit about some of the product updates. We're going to start doing this more and more on our webinars. Is talk about some new features. We'll choose these from new features, from features maybe we feel like that are underutilized. But we want to just hit on a couple here. And Sarah, we want to highlight this at the outset, and I think this is important, particularly for hospitals and underserved communities, but more broadly in terms of prioritization of who gets interviews and everything related to that. Do you want to speak to this slide a little bit? Because this is really important to us.
It is. It's really vital for us, and I think vital for our industry. And we are not unique in this way. Health systems across the nation deeply care about diversity, equity, and inclusion. And so this is something we do alongside our health systems, not something that is necessarily unique to us. But I think we all believe deeply here, based on research that supports this belief, that a diverse workforce is the fastest way to creativity. It is highly linked to optimal problem solving, and it ensures that in a healthcare setting, we have a better, sort of a greater health equity for marginalized groups that are seeking care. And so this is really important to us to ensure that our system is set up in such a way that it removes opportunity for unconscious bias from the process and supports our health systems in accomplishing their goals in terms of DEI. And so we're always investing in this space. We monitor our marketplace to ensure that that when we identify evidence of bias, we're understanding what's at the root of that and allowing the system itself to adapt to ensure that we can eliminate that. One of the things we've recently done based on that monitoring is to actually remove candidate last names from those profiles that we present. Of course, we always provide that information once there is a match, once a health system and a nurse say, yes, based on my experience and based on my need, I want to have a conversation that becomes transparent. But we just want to eliminate anything that we can that might create an unconscious bias in the process and ensure that every nurse is evaluated based on their abilities and their experience.
Love that. Awesome. Okay, the resume wizard. This is so cool. I just think this is the greatest thing. So 30% of nurses start their job search without a resume. Which it's going to be pretty challenging to find a job if you don't have a resume. So we actually take the guesswork out of that, and with our generative AI, which sounds super fancy, but it's 100% real, technology, essentially help you create that resume. So this is awesome and is being utilized right now, right, Sarah?
It is. I was really excited about this feature launch because it was something we heard from both sides of our marketplace. Our health systems are often dependent on an actual resume that they can download and send to a hiring manager to prepare them for the interview itself. It's typically a much faster, easier way to apply directly with a health system as well. If you have a completed resume that can be uploaded and then parsed by that applicant tracking system. But it's also something that nurses were saying, I don't have time to put this together. Like the last resume I put together was when I accepted this job I'm currently in 5 years ago. And there's lots of experience that I have now that isn't reflected. But this isn't an optimal skill set for a nurse to present the information in this way. It's not typically a high priority for them, but they know they have to have it to accurately represent the things that they have accomplished. And so I love it when that happens and we have this confluence of a need from both sides of our marketplace and we can just intervene and solve for both of those problems. And that's really what this resume wizard does. We take information that the nurses provide to us. We can offer them an opportunity to speak with someone and further refine the information. And then they have a resume. that they can use to apply for positions, both on and off the platform,
Love it. Very cool. Plus, we get to say that we have generative AI, which is fun.
which is just fun, really.
Okay, let's talk. Let's do some Q&A here. So we've got a couple of questions that have come in. Um, Shauna makes an interesting point. I think tenure improves when the framing and discussion is about a career that grows and flourishes as opposed to retention, which sounds like holding someone back. It's a great point, actually. Like when you actually phrase retention to your nursing staff, it makes it sound like you're holding them against their will, right? Like trying to retain you, as opposed to like, we want to help your career grow. I think some of that is right. Like it's in the actual discussion and how you have those discussions with your team, Sarah.
Well, and I think we get into a bad habit of discussing things that we wish for other people in terms of their benefit to us. And
Mm,
that's really what retention, that language, portends. So I love that comment that Shauna made, because when we're speaking to nurses about what we want, it's harder for them to find the benefit to them. But if we're speaking to them about, we are a place where your career can grow, we are a place where we want you to flourish and love what you do, that will naturally lead to retention, which is what ultimately the health system needs to happen. But it's doing it in a way that really honors the experience of that nurse, and as a partner in helping them accomplish their goals. So I'm a big believer in language really matters, words matter, and I love that suggestion, Shauna.
love that. And then Thea, and I hope I'm saying that right.
Oh, that's
Th-
Thea.
Thea, thank
Yeah.
you. Thea gives us a shout out. Thea, this is awesome. She says, I think nurses have a more positive first impression with Incredible Health. It is a more personalized feel from the beginning, especially with a large health system. Love that. Thea giving us a shout out. That's
Thea is
awesome.
also awesome at what she does. So this is a place where partnership works, where we can really see how important it is to have lockstep alignment in the health system and in the experience that we're creating for nurses. If we can help that experience be consistent and positive all the way through the process, Thea does a great job of this. We not only have a better chance of hiring those nurses, but of retaining them as well.
That's great. I love that. Sarah, any final thoughts today? We told everybody we try to keep it around a half hour, and we're sitting at 36 minutes or so right now. So, any final thoughts for everybody that you want to mention as we conclude today?
No, I think I just want to thank our health systems that are on the call today. It is a challenging time in the history of our industry, and finding creative ways to hire and retain staff has never been more important for all of us as just healthcare consumers. And I am fortunate to get to work with health systems across the nation that are deeply passionate about ensuring that we're serving populations well and that we're taking good care of our nurses. And so I just want to say thank you to the health systems on the line for providing that experience for nurses and for the communities that you serve.
Awesome. Sarah, thank you for taking time. I'm going to do one final check for questions here. Um, let's see. Okay, let's do a final one here. So, um, one final question, Sarah. Evidence suggests clinician emotional exhaustion, like burnout, is a precursor to healthcare inequity. How do we help address this? Because burnout is something we hear about a ton. Um, and it always shows up on our surveys when we say, what are the biggest reasons that you're leaving nursing or changing jobs? Burnout is like the thing more than pay. How do we help address that, particularly in these underserved hospitals serving underserved communities?
I the data absolutely supports that statement. I think in our study from earlier this year, where we asked nurses what was a concern for them, 70% of them said that they were worried about their own personal burnout. And that's a challenge that I think we have to face head on. This is not the easiest gig in the world, right? Being a nurse, it is challenging, and uh, especially in on floors and in specialties where the population exposure might expose them to more than their fair share of violence, of just negative experience for the nurse. And so, what we see is the health systems that really invest in support, tooling, virtual mental health benefits, are more successful in creating an environment that helps prevent that burnout. Some of the things we've talked about today about flexible scheduling, feeling like you have control over your career, and the direction that that's growing in, feeling like you have sufficient support from experienced nurses to help you do your job effectively. The nurse managers that are on the floor make all the difference in the world. And so, really keeping the nurse experience at the forefront of how we design care systems can absolutely not only help that nurse be more effective and retain, but to deliver a higher quality of care across the continuum, which is the core of what we need them to do as healthcare consumers.
I love it. Awesome. Sarah, thank you again for jumping on. Everybody, thank you for taking time out of your busy schedules. Get in touch with us, email us, go to our website. If you're interested in learning more and you're not a customer, let's get a demo and see if we can help. And if you are a customer, thank you for being a partner of ours and working with us as we try to solve this healthcare employment shortage. Thank you so much, everybody. Have a fantastic day. And what are we, Wednesday? Have a great rest of the week. Bye, everybody.